Informs, the largest association for the decision in data sciences, provides the following audio content to journalists for their use in reporting with proper attribution. What follows are 4 questions and responses from Timothy Chan. At the University of Toronto, he's the Canada Research Chair in Novel Optimization and Analytics in Health. He's a professor in the Department of Mechanical and Industrial Engineering. He's the director of the Center for Healthcare Engineering, and he's the director of the Center for Analytics and AI Engineering. He's also a member of Informs. Question 1. How have hospital operations, processes, and procedures been affected by the pandemic over the past 2 years?
There have been significant impacts across the board, from impacts on staff, such as staffing shortages and redeployment of staff, to impacts on patients, like canceled and delayed medical procedures. Fortunately, this has sparked many hospitals to think more innovatively about how they manage their operations. For example, during the peak of some of the COVID waves, hospitals started to transfer patients from more heavily loaded hospitals to less heavily loaded hospitals as a way to balance occupancy and improve the care that all of the patients receive.
Question 2. What are some of the lessons for hospitals and healthcare facilities from the pandemic?
I think one of the major lessons is the importance of having good systems in place that can help them weather the storm much better than trying to develop systems on the fly like we've seen for many hospitals. Being proactive in planning, having good insight into their own data to use to make planning decisions. I think these are important lessons that hospitals are learning now.
Question 3. When you look at these lessons, which functions within hospitals warrant the most amount of attention?
I would say that one important area that impacts all of these functions is staffing. Many hospitals found that they didn't have good data on staff availability and needs, for example. But this is an area that OR knows very well, how to optimize staffing and scheduling.
Question 4. How can hospitals and healthcare facilities incorporate those lessons into plans for the future?
I think that in hospitals, technology that supports operations has tended to lag behind other technology in the hospitals, like medical devices or new treatment machines. I think hospitals really need to rethink how they approach their operations, how critical, for example, having clean, real-time data is for supporting decision-making. When you look at other sectors, many companies that aren't actually technology companies or companies that you wouldn't think are technology companies are increasingly positioning themselves as a technology company specialized in sector X, for example. I think hospitals really need to start doing the same.
Please see the audio content release posted alongside this clip for attributions, soundbite length, and transcriptions. Any other questions can be sent to Ashley Smith, Informs Public Relations Specialist at asmith@informs.org.